Started this morning. Good morning, everyone. Welcome to our York County Community Sector briefing this Thursday morning. Lisa Hurley with York County Development Corporation, for those that may be watching online that don't know who I am. I would like to kick off the meeting by inviting Laura McDougall from Four Corners Health Department to go ahead and update us.
Good morning, everyone. So I would like to just start off with the Nebraska outlook at the moment. So according to our state system, we are still having quite a few cases in Douglas County, and the hospitals seem to be looking pretty good, and I'll let the hospital sector update you on that. We have over 17,000 cases total. We have had 234 deaths up to this point. So within our Four Corners district, we are actually having probably less than one case a day, which is really good news. We are at 134 positives total. Right now, our leading county is Butler County. We have 52 positives, and right now 6 people are sick, still sick. York County is the next one, and it's 38 positives, but in York County, only 2 people are sick right now. We have Seward County at 33, 5 people are sick there, and Polk County has 11 cases and 1 person is sick. So we are a total of 14 people in our whole district right now are sick still with coronavirus, with COVID. So that's down from where we had been, so that's good news. You all probably have seen that we have new directed health measures that will be taking place on June 22nd, so that's next Monday. Those new guidelines are on our website, and it will allow us to, those are the phase 3 guidelines, or the phase 3 directed health measures, so things will be opening up even more. And if you need to see a copy of those, that's on our website. So please go and check that out. One of the things that we have also been monitoring that the state is probably, this is kind of one of our public health measures that we look at, is every week with all the tests that are being done, what percentage of all the tests that are being done across our district are positive. And for last week, we had 295 tests done and 3 positives. So that's a 1% positivity rate. Over all of this time when we have been doing testing, we have had a 5.6% positivity rate. And you may hear about some other counties in our state, and like Colfax and some of those places where they still have positivity rates 40% or more. So those are some of the things that we're doing pretty good at a 1% positivity rate. We'd like to see it kind of stay there. And then just to let everybody know, we're going to be we're still working on that risk dial. We've been doing a lot of work with schools to talk about what does reopening look like. We're going to be working a lot with schools in the next weeks. We're hoping to get schools open, and we'll let the education sector talk a little bit more about that. One of the things I another thing I wanted to just talk about briefly is we would like to start spacing these briefings out a little bit. And I know that we have the 4th of July holiday coming up. It seems like it, and I also have been asked to do some workshops with schools on that week before the 4th of July. So what I would propose to everyone is if we could have our normal community briefing next week. We will just have had new health measures take effect, and I'm thinking there still might be a few questions around that. And then so we still have our next Thursday briefing, and then we'll start going every other week. And Lisa, how does that sound to you?
That sounds great to me, Laura.
Okay, all right. So I would propose that, and I think I'm going to let our medical sector and some of the other sectors talk about what's going on, because I know they've got some exciting stuff going on. One of the other thing is I'm going to have to jump off this call at 9 o'clock. And so if anybody has any questions for me, please ask them. I have to be on a state briefing and report out at 9. So I'd like to see if there's any questions. And I think I just got one. Laura, will masks be required to be worn at school? I believe that is a question we all have right now. And we're going to be working through that. There's, different scenarios as to what might be happening and how much disease might be, how much COVID might be in the area. So there will be scenarios where masks, there will be recommendations as to wearing masks in certain settings at school. We're still working on all that. So that's going to be, and every school is going to have their own plan. Some schools have different setups where they have more ability to social distance students too and things. So there's a lot of factors that go into that decision, and the schools are really trying to do their very best to make some of those decisions. So I think there will be a place though in a setting where probably masks will be used in schools. Okay, that's all. I'll be quiet now. I'm done. Thank you.
Does anyone else have questions for Laura before we move on to the local government sector? Okay, so next up would be Randy Obermeyer with York County Commissioners. Randy?
Good morning. Yep, we're here.
Good morning.
Yeah, and thanks, Laura, for your update. And we would be one that we don't have anything exciting going on, and that's just fine with us. We think we're finally back to what we would call somewhat normal. Last week's DMV visits were half from the week before. We're looking at all the counties across the state are now open. Almost all the DMV sites across the state are open. So I think as far as our locals, you should be able to use the courthouse with regularity throughout the week, and that's a great thing. So that right now, as far as county government is concerned, we're doing good. I would like to warn everybody is if they drive downtown, Lincoln Avenue put up with this last year during the winter months, and it looks like ours is starting today as the saws are out in front of our building. We got some water line construction going on, so just pay attention to it when you come visit us. Don't forget the downtown businesses. We're still going to be here. You may have to use some backdoor entrances, different things like that. But hopefully this project's much shorter. It'll get done much quicker. Maybe Barry will touch on it a little bit for us here too. But that's all I got today.
Thank you, Randy, very much. Barry, can you provide an update from the city of York?
I told him to start in front of Randy's building. Just no, I would say the same thing as Randy. Not a lot to report. The new health directives came out, so Cherie was. I could hear Cherie be very happy clear across town that the swimming pool will be a little less restrictive, and they'll have to not do the shifts quite the same way. But that opens it up a lot for up there where. Hopefully people can still social distance, enjoy themselves, but they won't have to spend all their time monitoring. So she's excited about that. I would mention just because we need the room and for this time, the city council meeting tonight at 7 o'clock is at the auditorium. A few things on the agenda with kind of some of the things that have carried over from the group homes conversation and also maybe some good news on some improvements to the auditorium and community center. But with that, most of the city operations are kind of operating, and I know the convention center is back and operating, and so these rule changes they're still kind of trying to digest, and people that had planned weddings for July can replan their wedding for July in a certain way. So with all of that, but for the most part, let's just hope things stay nice and quiet. So that's all I have.
Thank you very much, Barry. Okay, we have a message from the city of Henderson. They did not have an update. I know Benedict is on. do you guys have an update you want to provide? If so, go ahead and jump on. Any of the other communities, this would be the time. Okay, so we'll go ahead and go to the medical sector, and we'll start with Jim.
Good morning, everyone. A few things going on with the direct health measures and just Test Nebraska coming today. So I'll start off with that, maybe just on the testing front. A little bit different than what I've talked about before. I'm going to bring up kind of what we're thinking about today, and actually we're starting to talk about what we're going to do more long-term for testing too. As you know, we get maybe away from the peak of COVID-19 and get into more normal, just what we're probably going to gravitate to. So Test Nebraska is here today and tomorrow. I'm waiting for her to make sure that Laura doesn't disagree with that. They're still that way. We have a crew that's out at the fairgrounds right now. Should have been from 8 till noon, I think, doing the training with Test Nebraska. And 3 of our hospitals in our district are working with Test Nebraska along with Four Corners to get this set up where our healthcare facilities will take over the operations of Test Nebraska under their mechanisms of their, they still go through the website and check in and everything, but we'll facilitate it, maybe is a better word for that. And so Test Nebraska is one of those rungs of testing that we'll be involved in. The other one is the rapid testing, the ID Now that we're doing. This also is state-provided equipment for us, and we're in the validation phase of that. Working with that equipment, that'll continue for a little bit yet, and that is some very rapid turnaround tests for, has to be doctor-ordered, and those individuals to be tested are symptomatic as certain symptoms that they show. So it's not for everyone on that end. But we have had actually heard today from Jenny Obermeyer that we had some test results that are coming back on that ID Now in 19 minutes. So that's pretty good. And rapid testing is very important, yes, for our public and everything, but it's extremely important going ahead for us in our long-term care setting. The more rapid we can get, or even in our healthcare facilities, because if you're looking at staffing a shift or into the next day and you happen to have some exposure, if you can get an individual tested or individuals tested, then you can know if they can go into a shift or not, or that they can continue to work. And so that's going to be important for us going ahead. We still have our outpatient drive-through testing that's going strong. We've Laura mentioned a number of tests have been done over the last week. We've conducted so far this week 52 tests through our drive-through. So that is not slowing down. Those are some of our preoperative testing now makes up a good chunk of that as well that we're doing right now. We also into the future continue to look at our Abbott lab machine and our BioFire mechanisms for doing rapid testing. And from the day one, we've been looking at that as an option and just can't get the reagents for that because we're always being told they're going to the hotspot areas, and we're blessed that we're not a hotspot area, comparably in the state. So if we can get that in July, that can be a part of our equation too, that we can look at our future testing. And as we get into flu season, as we get into other viruses that crop up, are we going to be looking at some sort of ability to do some sort of panel testing for viruses? I don't know if it'll be insurance company accepted or not, but we're going to be looking at these sort of things in the future, as it won't just be COVID-19 that we'll be testing for in the future, continue as we do for influenza testing and all that. We have to be thinking of that in the weeks ahead. So a lot of our planning is drifting also in that direction as well. So a few other things, Jay and Michelle, for the administrators for both the Hearthstone and the nursing home, are finishing their plans for the state, which are due the 22nd. I believe the Willowbrook one's essentially done, and Jay Coburn for the Hearthstone is working on theirs. Also beginning to formulate plans on how they're going to baseline testing of staff that's required in order to enter in, I believe, even into phase 1 of the directives through the state on beginning to reopen the nursing homes. So, and assisted livings to any kind of visitation and loosening of restrictions. So we're busy doing that. Continue to be busier in wellness center and the hospital, and things are getting closer to normal on that in the visiting specialist area and the surgery area. Now, a couple other things that I'm just going to pass on for York Medical Clinic. I don't believe anybody's on here for York Medical, but I know they'd be happy with me just mentioning this, that their hours are now going till 6 p.m. again. And in July, they're going to be going back to more of a normal schedule. Now, there'll be more communication on this in the days ahead, but that will also include like Saturday morning clinics again, you know, at the clinic on Saturday mornings starting in July. And so that's what I heard of from them this morning in another meeting I was in. So just a lot of things beginning to slowly open up. I do know that if you listen to the national news, and we're not among these states, but I've heard up to 21 states that are seeing an upward tick in their cases. I'm sure you've heard that too, Laura, across the nation. And we're not one of those. Douglas County, like Laura mentioned, is still continues to have higher level of cases. But if you look at the DHHS website, they have a new tab on there that talks about the last 14 days. Laura, I visited that. I don't know if you have. There's a whole lot of counties that have either 1 or 0 cases over the last 14 days. And you look at like the top 4 or 5, and that's going to count for probably 80 or more % of overall cases in the state that have cropped over the last 14 days. And so, knock on wood, let's keep our district the way it is. Laura, I know that you and I watch that all the time, and I think we went 14 days without a case in York, and then 1 cropped up here. And so we've only had 1 over the last probably 2.5 weeks, I bet, on that end. So hopefully that will stay the same, and we can begin to gradually continue to open up things gradually. So that's all I have today, and I also have to step off in about 5 minutes or so. So thank you.
Thank you, Jim. Lisa, are you still on for Henderson Healthcare? Okay, we will move on to unless anyone else is on from the medical sector, we'll move on to the education. And I'm going to start with York Public Schools because I have that update. Mitch was not able to be on this morning. He said the York High School graduation is at 2 p.m. June 27th. With the updated health mandates, they are now able to have 8 people per family. It will still be a private ceremony, and all guests have to be pre-registered, and the senior has to do that. YPS continues to work on their fall blueprint. They will communicate their progress to the families and community every 2 weeks. They were told on Monday by the Commissioner of Education that the expectation is to have students in our buildings in the fall. They're excited about that, and they have a lot of work to accomplish prior to that point. Madonna, do we have any other superintendents on?
Give it a quick double check.
Okay. Okay. Not seeing you, we'll go ahead and move on. SCC. Oh.
Emily Lutz.
Okay, SCC also has no update for today. And Emily from York College,
I do have an update. We announced to our students that following Thanksgiving break, they will finish the last 2 weeks of classes online and then take finals online as well. So they'll stay home. They won't come back from Thanksgiving break. We are still expecting to start on time, like I had previously mentioned, and fall athletes will start a little bit before that. Just so that they can get their early practice stuff in. Obviously still waiting on information from the NAIA that will guide some of the way that they do athletic things. The other thing we wanted to just let the community know that we are still looking at doing our homecoming event on October 16th and 17th. We're looking at the schedule, trying to address any issues where size may be a thing, obviously trying to limit interactions between our guests and our students. We will really get into that after our new president starts on July 6th with him. Obviously, we will work with Four Corners, talk to them. We're looking at kind of our traditional event venues if we need to split up groups even more, like the convention center, the country club, but we're open to any other suggestions of places people might have that we could send groups of alumni to gather kind of on their own. So that's the latest that we have.
Thank you very much, Emily.
Mm-hmm.
Okay, so now on to the faith communities and nonprofits. I will say before Erin or anyone else hops on that DHHS, Brandy said they have no update this morning and she was not able to be on. So I'm gonna turn it over. I know Erin's on. I'm not sure. I know we're not staying on.
Morning, everyone. This is
Good
Erin
morning,
with York
Erin.
County Health Coalition. Not much of an update. We are expecting, though, to continue to see applicants come in across all nonprofits for emergency assistance, for rent assistance, utility assistance. So as we are moving back to more of a normal routine, please just keep in mind we are expecting to continue to see the ripple effect in households. So please keep in mind all the nonprofits with donations, monetary gifts, and continue to send your employees or clients to emergency assistance locations.
Thank you very much, Erin. I appreciate it. Okay, I'm going to go ahead and start. I skipped our section for the business, but that's okay, Madonna, and I can wait for that stuff. First, I want to announce that the child care forum that I've talked about the last 2 weeks is being postponed until such a time when we can get our keynote speakers and get everybody together in person instead of doing it virtually. We think there's an important component to that. On that note, the business child care survey that we emailed out to either business owners or the HR departments, it is still ongoing. If you did not receive that link, please let Derek or myself know in the office and we will email it to you. If you need it again, we'll send it out. And we encourage you to take the survey as we analyze what our child care needs are moving forward. Next, the PPP program does expire. The application process ends June 30th. So if you're a business that qualifies and you need the assistance and you have not applied, please work with your banker in the next week or so to get that done. There is some funding available, and all the banks in York County are very familiar with the program. Okay, next, last Friday, the governor announced the Get Nebraska Growing initiative, and that is how Nebraska will be utilizing the CARE funds that were allocated to us. The two items I am going to focus on today is a small business stabilization grant. The governor and the team put together $330 million for working capital operating expenses for small businesses. There's a few that don't qualify, and you have to have between 5 and 49 employees according to the state guidelines. That's for both small businesses and then livestock producers as well. The livestock producer application process, there was a glitch the first part of the week because these both opened up on Monday, and they have put a pause on the application. If you're a producer, I highly encourage you to still go to the website, download the preparation PDF, and get it ready. So when it reopens on Monday, you can go ahead and go through it. If you have problems, go ahead and contact me or contact the Department of Economic Development. There are some things that could trigger some issues as you go through the problem, or the process, not the problem. So reach out to me if you need assistance. Now, on the small business stabilization portion of it, the system was being a little overwhelmed yesterday. What the Department of Economic Development told me, and that they put out publicly, was to continue to keep trying. you will get into the system eventually. There was just a lot of people on it yesterday. So if you, basically everything you need, if you put in a PPP application, you have in your file. But print off the printable PDF with that preparation form, so you have everything gathered when it's ready. That way when you get online, you're ready to go. The next portion that I think would be very attractive towards some of our manufacturers, some of our larger businesses, would be the Gallup Business Leadership Training Grant. That is training for managers. It's a 30-week online course, and the application deadline is June 22nd. That program is available to businesses that qualify for Nebraska Advantage. So unfortunately, the small retail businesses and restaurants, they're not going to qualify. We're looking at the manufacturers, the employers for that one. And then that is all I have. I'll bring Madonna up at this point.
Good morning. I just have a few quick reminders. Tonight is the first farmers market, and that is being coordinated by York County Relay for Life. Sadie Wright is crushing it. She is has put together quite a list of vendors, and we look forward to seeing everybody at 5 p.m. at Kilgore Memorial Library. The market traditionally goes rain or shine, so it might be a little damp, but hopefully it'll hold off. Then tomorrow night is the outdoor cinema out at the Convention Center featuring Tommy Boy. And then, of course, Firecracker Frenzy's July 3rd. We're just really excited to be able to have good community events for our community. And all of our safety measures are in place for those.
Thank you very much, Madonna. And with our report, that brings the meeting to an end. Unless somebody has questions, please feel free to jump on, or if you're a business and want to add something from your component. Otherwise, we will see you next week. Have a fabulous week. And then as a reminder, after next week, Cindy, I'll get back to you on that question. After next week, we'll be going to every other week unless circumstances change. Have a fantastic weekend. Thank you.